Hi, my name is Sarah Regan. I am a nurse practitioner student at Maryville University, and I am here to do my head-to-toe assessment. I have a 31-year-old male patient who has volunteered himself. His name is Brett. So we're going to go ahead and get started. Prior to the exam, I had him empty his bladder. I also had him put on a gown, and we did a set of vitals, which include blood pressure, respirations, heart rate, temperature, oxygen, and then we did a height and weight as well. So I'm going to just go ahead and start. We'll start from your head and work down and kind of go from there. So I'm just going to go ahead and take a look at your head. Your hair looks evenly distributed. I don't see any spots, no moles or lesions or bumps, and everything feels symmetrical. So I'm going to go ahead and take a look at your face, look at your eyebrows. The hair is evenly distributed, and I don't see any lesions on your eyebrows. I'm going to go ahead and palpate your lacrimal gland. Any pain here?
No.
Okay. I'm also just looking at your ears to make sure that they're even with your eyes, and looking at your eyes, seeing if they're symmetrical. And then if you'll close your eyes. Any pain here?
No.
Looks good. No lesions. No, I don't see any freckles or anything on your eyelids that I would be concerned about. We're going to go ahead and test some of the cranial nerves, so we'll go ahead and see how your optic nerve is. So if you'll go ahead and clench your eyes closed for me. Okay, and that was intact, and then will you wrinkle your forehead? Just testing. There's about 11 cranial nerves that we're testing, but that one's number 5, so. And then if you'll blow out your cheeks, that's number 7. Any problems with your smelling?
No.
Okay, that would be cranial nerve 1. If you'll smile for me, looks good. Stick out your tongue, move side to side, looks good. So I'm going to go ahead and take a look at your eyes, just looking at your conjunctiva and your sclera. Sorry, I'm going to pull your eyelid down. Looks pink and moist. And I don't see any lesions or any foreign bodies in your eyes. No drainage coming from your eyes, so that all looks good. I'm also going to look at your nose and look at your septum. Looks straight. I don't see any fractures or anything of that nature. I'm going to go ahead and take a look in your nose. Both sides, looking at your septum, making sure I don't see any drainage or any lesions in there, and I don't. Your nasal hair is on both sides, so that is good. We'll go ahead and take a look at your mouth. So if you open up and say ah.
Ah.
So I'm just looking at your tongue, looking for any dryness, cracking. If you'll lift up your tongue. Good. Your floor of your mouth looks moist and pink, and I don't see any bumps or anything of that nature. And then I'll look at your palate. You'll open up. Looks good. And your uvula is centered. I don't see any tonsils, so you think you've had your tonsils removed.
No.
And then I'm also just looking at your lips. They're moist and pink and plush, and I don't see any lesions or any lumps or bumps on your lips, so that all looks good. I'm going to go ahead and palpate your TMJ joint, so if you open and close, any pain with that?
Nope.
This also tests your cranial nerve 7, if you'll just clench your teeth. Any pain?
No.
Okay, that all looks good. So I'm going to go ahead and take a look at your ears. So just looking at your tympanic membrane. It looks pearly gray. Look at the other one. Looks pearly gray, and I don't see any drainage, any pain in your pinna. Like again, I said, your ears are even, so that is all normal. So now I'm going to go ahead and just palpate your face, feeling your sinuses. Any pain here?
No.
All right. That all looks good. So I'm going to go ahead and palpate your pre-ocular lymph nodes in the front, and then your post-ocular lymph nodes in the back. I don't feel anything abnormal, and then your submandibular, your submental, and then your pre-cervical, your post-cervical, and then your deep cervical, and then your supraclavicular. All looks good. I'm going to also, while I'm here, just palpate your axillary, your lymph nodes, and your armpits. Make sure I don't feel anything.
Sorry, I'm tickling.
And then your supraclavicular lymph nodes in your chest. And I don't feel anything swollen at all. So that all looks good. So I'm also going to have you lift up your chin, feel your thyroid, and your trachea is midline. I don't feel any nodules or anything. If you'll go ahead and swallow. And it's smooth, and I don't feel anything that I'd be concerned about with your trachea.
Okay.
So we will go ahead and move on down to your chest. So I'm going to go ahead and I'll start with listening to you, and then I'll palpate you and percuss, and we'll do all of that. And we'll move on to the back after that. So I'm going to go ahead and listen to your heart. Listen to your aorta, your pulmonic, Erb's point, tricuspid, the mitral. And I'll do it again with the bell of my stethoscope. That all sounds good. I'm just going to listen to your lungs while I'm here. If you'll take a deep breath. One more. Again. I'll give you a break.
Thanks.
And that all sounds clear. I was looking for any adventitious breath sounds. I didn't hear anything. Lungs were clear. So that all looks good. Now I'm going to go ahead and palpate, just looking for any crepitus, which I don't feel any pain.
No.
I'm going to feel your pericardium, looking for any thrills or heaves or anything of that nature, which I do not feel anything. I'm also going to have you say 99 when I put my hands on your chest, just looking for any difference in vibrations on either side. So I'll say 99.
99, 99, 99, 99.
That all looks good. I didn't feel any difference in either side. I would also be inspecting the skin, making sure that I don't see any moles or any bumps or bruises or anything of that nature, looking to make sure his chest is symmetrical, which it is. So I'm going to go ahead and have you turn around so we can see the back side. And you can sit however you feel most comfortable, if you want to cross your legs or anything of that. So I'm going to have you bend forward. Just going to look at your spine, making sure there's no scoliosis or kyphosis or anything of that nature, which I do not feel. Making sure all of this is intact and there's no pain. Okay, you can go ahead and sit up. I'm also going to have you take a deep breath in, looking to make sure that the diaphragmatic excursion is equal on both sides. So if I take a deep breath, looking at my hands, that all is normal and symmetrical on both sides. I'm also going to listen to you. So if you take a deep breath. all sounds good. I'm also going to go ahead and percuss your back and make sure that I don't hear any abnormal sounds like any dullness, which would indicate a tumor or a mass, or also like an organ, anything of that nature. So I'm going to go ahead and percuss, or yes. I'm also going to have you take a deep breath in and hold it. I'm going to percuss for the diaphragmatic excursion. So if you'll just take a nice deep breath in and hold. Right about here, we would make a mark. You can breathe. And then we'll go ahead and do that again. If you'll take a deep breath and hold. There. So it should be, you can breathe. Normal is about 3 to 5 centimeters, so that all looks good. Normal on, we would do it on both sides. For the purpose of this video, we won't do it on the other side. What else am I going to look at on your back? I would also just make sure that I don't see any moles or any lesions or anything of that nature on your back, which I don't see. So I can have you turn over on the other side again. And we'll go ahead and I'm going to percuss your front, looking for Renaissance sounds, and then if I hear any dullness or timpani or anything of that nature, it would be abnormal, but I don't foresee that happening, so we'll go ahead and percuss. That all looks good. So I'm going to go ahead and have you put your arms out straight and just try to resist. Good. And we'll go push down. Good. And then lift your shoulders. Just looking at your muscular strength, which is all intact. I also forgot to palpate your carotid artery, so I'm going to go ahead and do that. We'll palpate those on both sides. Nice slow heart rate. Means you're athletic. I'm going to listen to your carotid arteries. Follow my stethoscope. Listen to your trachea. I also would like to do a couple of tests on you. So before we move on to your abdomen, we'll go ahead and do a couple of tests. One, to test your hearing. So we'll start with a whisper test. I'll whisper a number or a letter in your ear multiple times, and you just tell me what you hear.
More. 5. F.
Okay.
3. 1. 8.
Okay. So your hearing seems to be intact in that sense. We'll go ahead and do the Weber test. So I'm going to strike this on my hand and put it on your head. Let me know if you hear the vibrations on both sides or one side, okay?
Okay. Left side.
Just your left side?
Yep.
Okay. So I'm going to go ahead and do this and put this on the back of your ear. Tell me when you stop hearing it.
Okay. Stopped.
Okay.
Stopped.
Okay.
Stopped. Stopped.
Okay. So it looks like your hearing's intact. Bilaterally, I did the Weber test, was the one on top, and the Rin test was on where we were testing the bone conduction and the air conduction, which is a 2-to-1 ratio, so yours was normal. We also did the vision test to test your distant vision, which was the Rosenbaum test. No, the near vision was the Rosenbaum test, and the Snellen was the distant vision. So we did those, and those were intact. I'm also going to go ahead and have you look at my finger, and we'll do the 6 cardinal signs of gaze, and this test for the cranial nerve too. So if you'll just follow my finger. And your pupils they're equal, reactive. They all look, all of your cardinal signs of, the 6 cardinal signs of gaze were all intact. Sorry, I'm losing my mind. I was looking for any nystagmus or any rapid eye movements, and you did not have any, which was all good. So we're going to go ahead and move down to your abdomen, and if I forget anything, we'll come back to whatever I forgot. Have you had any pain in your abdomen?
Nope.
Okay. I'm going to go ahead and have you lay down. If you'll lay down actually this way.
Like this.
We'll have you lay this, actually. I'll have you go back that way with your legs this way. And just lay, yeah. Sorry about that. We'll lift your shirt up. I'm just doing a general inspection of your abdomen, looking for any bumps or masses or abnormal markings or any moles that I would see. I'm also going to take a look at your contour, which is flat, and I don't see any distension of your abdomen at all. You haven't been having any
no.
Stomach pain? Okay. So I'm going to go ahead and take a listen first, making sure you have vowel sounds. Sounds good. I'm going to listen to your aortic artery, listening for any pulse, any thrills or breathes, which I don't hear. We'll listen to your renal arteries, your iliac, and your femoral. Do the same thing on the other side. That all looks good. I didn't hear any breeze or thrills in your arteries, so that means you have good perfusion to your legs. I'm going to go ahead and palpate. Any pain?
No.
I'm going to do a little deeper palpation. Any pain with that?
No.
So I would kind of feel your liver on this right upper area. I would not be able to feel your spleen, which I cannot. If I would, that means your spleen would be inflamed. Can kind of feel your kidneys on both sides, but that all looks good. I'm also going to feel your femoral pulse. Perfusion on both sides. I'm going to go ahead and percuss your liver just to make sure that it's normal size. Which it is. It's about 5 to 6 centimeters, which is normal. I'm going to go ahead and percuss the rest of your stomach, just listen for any abnormalities. I hear some dullness over your spleen, which is normal. So that all looks good. We can go ahead and sit back up, looking at your abdominal muscles, making sure you can pull yourself up. I also forgot that I want to check your brachial pulses, which are good, and your radial pulses. We'll go ahead and do your popliteal pulses. And your dorsal medial and your dorsal medial pulses. Okay. Couple of things that I forgot that we're going to go ahead and do. I'm going to do some sensation tests on your face and on your legs. So let me know if you feel this on your face. You feel it?
Mm-hmm.
Feel that?
Yep. Yep. Yep.
Okay. And I'll do your legs. Feel
Yep.
this?
Yep. Yep. Yep.
Okay. Also going to have you stick out your tongue and do your gag reflex. Okay. That all is intact. Sorry about that. Going to go ahead and do your reflex hammer. Let me grab the reflex hammer. Drop. We'll do your brachial reflexes. That's intact, and your radial. All looks good. Your knee. All looks good. Then we'll go ahead and do your foot long. I don't see any drop foot, so that all looks good. I'm going to have you stand up and do a squat for me. Looks good. I'm going to have you turn around. I'm going to do the costal vertebral just to check your kidneys. Make sure you don't have any pain. Any pain with that?
Nope.
Okay. I also looked at your legs, making sure that you have equal hair distribution on both legs, and both legs looked good. I didn't see any lesions or abnormalities, no wounds or anything of that nature. So I think we are all done. Thank you so much for your participation in this head-to-toe assessment.